Hi, everyone. Good afternoon. Thanks for coming today. So glad to have you here. My name is Carolyn Evamy, and I am a research associate here at the National Safety Council. And I'm going to spend the next hour walking through a series of papers published by the National Safety Council's Campbell Institute on the topic of safety metrics. So please feel free to put questions into the chat and throughout the session, and we'll try to get to them at the end of my presentation. There's a lot to review today. This work stretches all the way back to our first publication as the Campbell Institute on leading indicators over 10 yeyears ago, and leads all the way up to our most recent publication back in 2025. So whether you're brand new to leading indicators or you've been working with them for years, my goal today really is to walk you through this material and shine a light on some of the free tools and resources that are already available to you. The Campbell Institute has always prioritized creating public-facing, openly accessible materials. And if you visit our website, you'll find a full library of those publications on leading indicators and then on many other topics in EHS as well. It's really an honor to walk through this work with you today and try to give you new ways to explore and apply the Institute's findings. And I wanted to emphasize that what you see today is really just the beginning. We have a wealth of additional resources that can support you long after the session is over. And with that, I always like to share this next slide because one of the things that truly sets the National Safety Council apart is our commitment to data-driven decision making. From the very beginning, National Safety Council has believed in the power of research to drive real change. This commitment dates all the way back to 1921 when the council published its first comprehensive analysis on public accidents. And since then, its data has been the foundation for everything that we do, from program development to policy recommendations to safety campaigns and educational tools. Over the decades, NSC has continued to evolve, publishing resources like Injury Facts, which is a publicly accessible data repository of workplace preventable injuries and deaths, and countless special reports. And you can see some of those milestone additions here that range all the way back from early black and white reports to the more modern and interactive formats that we use today. These publications have become a trusted reference in the safety world, relied on by industries, lawmakers, and educators alike. But the goal here has always remained the same: to collect accurate, actionable data and use it to reduce risk, prevent harm, and ultimately save lives. NSC really doesn't just follow the data, they lead with it. Every safety recommendation, every training module, every strategic initiative is rooted in careful analysis and rigorous research. And that's an incredibly important component to emphasize because really, when the goal is zero preventable deaths, you cannot afford to guess. And the NSC understands that very well. Today, I'm speaking to you as an employee of the National Safety Council, but also as a research associate for the Campbell Institute, which is just one of many membership opportunities that the NSE offers. The Campbell Institute exists with a very powerful mission to be the trusted source for promoting EHS excellence. The Institute is a respected global thought leader for knowledge on keeping people safe. When it comes to looking after health and safety of all individuals on and off the job and their communities, organizations seek out the Institute for expert knowledge and progressive research. The Institute empowers organizations of all sizes and sectors to become world class in EHS through engagement and knowledge sharing. So, no matter where they are on their safety journey, we hope to inspire all organizations to attain and maintain the highest EHS standards through the gathering and sharing of these member best practices. And these are the organizations that make up the Campbell Institute. And they're really the organizations that make the Campbell Institute what it is. Because membership really isn't just a name on a list here. It's a commitment to advancing EHS and shaping the future of workplace safety. Our members are the ones who bring this work to life. They drive programs, share insights, and they collaborate to solve some of the toughest challenges in safety and health. What makes the Campbell membership unique is really the depth of its engagement. It's not just about policies, it's really about people. We work together, we listen, we learn, and we challenge old ways of thinking. We share hard truths, we embrace feedback, and we push for approaches that make safety a real, human, and evolving concept. So, from research and strategy to implementation and advocacy, our members lead the way. They're building cultures where safety isn't a box to check, it's a value that's lived every day. And that's a real power of being a part of the Campbell Institute. Could definitely say firsthand that some of the most engaged and passionate folks that I've gotten the chance to speak to as members. But to get us started into the leading indicator or safety metrics discussion, before we can really talk about what is the ideal safety metric for your organization, how can you improve your current metrics, we really need a clear foundation of what we mean by leading indicators. And more so, our research at the Campbell Institute emphasizes that this step, defining leading indicators, is really a critical first step for any organization's journey. And that's really because in this phase, define means taking a step back to understand what makes a leading indicator effective. So the members actually described leading indicators as things like proactive and preventative and predictive measures as things that were just that are signals to help us identify and eliminate risks before they result in incidents or injuries. We know from the research too that strong leading indicators share a set of important attributes. They're actionable, timely, explainable, and meaningful to the people that use them. So this is an important step of the research because we're really asking in this case, what should we be paying attention to in regards to leading indicators? What actually helps us anticipate and reduce risk? And then really importantly, how do we ensure that the indicators that we choose can be acted on at the front line? And establishing this clarity early ensures that everything built afterwards, from alignment to design, is really grounded in purpose rather than just in measurement. And I wanted to take just a moment to highlight, one of the most persistent challenges in modern day CT management or CT metrics, which is the disconnect between recordable incident rates and serious incident and fatality outcomes. For years, organizations have relied heavily on TRIR as the primary measure of safety performance. But we now understand, and what the research has consistently showed, is that TRIR trends don't have a direct correlation or have little correlation with serious injury and fatality events, which means that a company can drive its recordable rate down year after year and still experience life-altering injuries and incidents. And also the reverse is true, where a site with a higher TRIR isn't necessarily having an increased risk of serious incidents and fatalities. So what does that mean? The core issue here is really that TRIR counts frequency and not severity or potential. So most recordables come from low energy events, things like strains, slips, cuts, while SIFs or serious injuries and fatalities emerge from entirely different risk pathways. High energy exposures, think process deviations, control failures, and weak barriers. So these two categories don't behave the same, and they don't respond then to the same controls. And so this really an important why I wanted to bring this to today. If TRIR cannot tell us where our most serious risks are, then we need a different approach. And this is one thing that really drove the Campbell Institute's work on leading indicators, shifting our attention from counting injuries to understanding things like precursors, conditions, and system weaknesses that actually predict SIF potential. And, this realization is really why leading indicators matter. And they give us this type of visibility that something like TRIR might not. And with this, we're really contrasting two very different ways of thinking about incidents. Heinrich's classic triangle, safety triangle, and the modern SIF prevention model by the NSC. And for decades, the Heinrich's safety triangle suggested that reducing minor injuries would naturally reduce severe ones. But now we know, and what many organizations at the Campbell Institute discovered directly through experience, is that those serious injuries and fatalities don't share the same causes or pathways as low severity recordables. So high reliability organizations actually repeatedly emphasize that focusing too heavily on those lagging indicators can both unintentionally drive the wrong behaviors and distract from the real precursors of things like serious incidents and fatality or and fatal events. So organizations found that their incident rates could be low or even near zero, while CIF exposures were still present and largely invisible if you were only counting recordables. And this is why many participants shifted towards these leading indicators that reveal these types of high energy hazards, barrier weaknesses, and system failures, rather than relying on, frequency-based assumptions alone. And so I have it here on the right, but the message here is really simple. Different severity, different causes, different strategy. If low severity events and CIF don't share common drivers, then we can't expect a traditional triangle style approach to prevent the most serious outcomes. The CIF prevention model requires us to look more upstream at the things that actually predict catastrophic events. Things like risk controls, operational discipline, work planning, and indicators that tell us when barriers are degrading or are weak. This shift is really what moved the community, on focusing and defining and designing more intentional leading indicators, ones that help us see and act on CIF potential long before it becomes an actual event. So as mentioned, the Campbell Institute research did define leading indicators as proactive, preventative, and predictive measures, and things that help us signal risk before they lead to incidents. A key distinction from the paper that I think is really interesting is that it was emphasized that leading and lagging indicators are not inverse or opposites. They really exist on a continuum, showing us that conditions happen both what conditions happen both before and after an event. And that means that there's a strong safety system that relies on understanding what happens upstream, understanding what workers are seeing, what controls are stressed, and where hazards are emerging long before those conditions start showing up in lagging injury data. Um, so if we're thinking about proactive measurements, we're thinking about getting ahead and not reacting to them. If we're thinking about preventative measurements, we're thinking about any type of measurement that has the potential to change an outcome. If we're thinking about predictive measurements, we're hoping to help us identify patterns or trends that signal what may happen next. And this definition really matters because it shaped every decision that followed. What we measured, how we prioritize, and how well we can actually influence serious injury and fatality risk. Um, and so uh, in addition to that, we also had our members share some of the critical characteristics of robust leading indicators that they thought were incredibly important to establishing again, a really robust leading indicator. So these characteristics came directly from the Campbell Institute research and the expert panels that they convened. And in multiple studies, they found that effective leading indicators consistently shared these qualities. So they were actionable. The indicator tells you what to do next. If a metric can't guide action, it quickly becomes just another number to folks. It was something that needed to be achievable. So organizations had to be able to realistically collect and use the same data. It had to be timely. The information had to come early enough to actually influence decisions before risk escalates. It was important to have them be both transparent and explainable so people at all levels could and should understand what the indicator means, why it's calculated, and why it's being implemented. In addition to that, there's meaning and usefulness within the robust leading indicators. So things that where the metric should reflect something that matters for safety performance. It's not something that's convenient to count, for instance, as an alternative, and that it should be valid. It should be it should reliably reflect the condition or behavior it's intended to measure. And so, just like we discussed on the previous slide, people use different definitions for leading indicators, but the work from the Campbell Institute was really clear that the strongest characteristics are those proactive, preventative, and predictive, and they embody these characteristics in practice. So this set of qualities becomes really a filter that organizations can use when selecting or refining their indicators, which is in hopes to move beyond activity counts and measure, metrics that truly reflect risk and overall system health. Now that we've just defined what leading indicators are, the next step is really to align. So that's really understanding how organizations use them and what enablers or constraints that process. The Campbell Institute research shows us that the strongest definitions won't translate into real world improvement unless the indicators are aligned with how the organization actually operates on a day-to-day basis. So across 8 companies in a study, alignment meant bringing leading indicators into the fabric of the safety management system and really not treating them as a standalone program. Participants repeatedly emphasized that leading indicators only gain traction when they are supported by leadership, integrated into existing workflows, and communicated consistently across functions like HR, maintenance, finance, etc. And this cross-functional engagement specifically was viewed as essential to ensuring that everyone understood how their decisions and actions affected risk. Alignment also, acknowledged barriers. Many organizations struggled with these challenges, challenges like, inconsistent data quality, historical overemphasis on lagging indicators, and a few more that I'll get to in a moment here. Um, it's yet, these organizations that were most successful, like really leaned into iteration, learning from these barriers, learning from these challenges, refining their approach, testing, and then communicating their predictive value to stakeholders at all levels. So when we're talking about align here, we're really talking about creating conditions where leading indicators can work. Leadership support, cross-functional involvement, shared understanding, and even organizational maturity are all parts to what makes a leading indicator a truly valuable and meaningful metric for folks. When we look at, I wanted to just share out. So in our 2025 paper, we did a follow-up study looking at really what were those enablers. If we could list them and identify patterns, how would that look? And the findings really emphasize that organizations not often or often struggle not because the metrics themselves are wrong, but because they lack some type of infrastructure, alignment, or communication approach that's needed to integrate those metrics into everyday decision making. So I just listed a couple here that we identified as some of the most important enablers to implementing leading indicators successfully. So we saw things here like cross-functional collaboration and engagement again, customization of indicators to specific business units or sites, inclusion of site level staff in tool development and goal setting, I think really important here, and also, something I will say that is a newer finding that might go along with our safety 2.0 and HOP discussions is this non-punitive anonymous reporting system. So folks emphasized here that the anonymity of this is a really an introduction for folks to provide the frontline workforce an opportunity to give that feedback without any fear of repercussion, not necessarily as a prescriptive recommendation. Um, but something to be especially considerate of, if there's a reputation at your organization where folks don't feel as comfortable to share the very useful and needed information out. In addition, we saw regular communication and review of metrics with leadership to support continuous improvement. Intentional selections of indicators that reflect the organization's highest safety risks and are actionable at the operational level. Use of data analytics and dashboards to track leading indicators for visualization and reporting. And then use of facilitators to improve the quality of incident investigations themselves. On the flip side, there were also some barriers identified to successful implementation. As you can see here, we saw competing priorities. So things like safety versus performance being a challenge, difficulty in aligning corporate goals with site level capabilities, insufficient resources at the site level to implement new tools or initiatives, lack of clear messaging from leadership on the importance of leading indicators, lack of real-time data for some metrics. Some folks let us know that they're not receiving that type of data on a regular basis. That's coming in chunks and at random times, or maybe once annually or once quarterly, not at a time where not at a rate where they felt like it could be actionable. lack of training or qualified personnel to evaluate risk assessments, poor data quality and inconsistencies across systems, which I'm sure or I anticipate will continue to be a challenge with more and more integration of AI and generative AI. Too many metrics being tracked, leading to data overload, collecting so much data that you do not know where to look, essentially. And then turnover in key leadership roles affecting continuity, making sure that that leader is not the standalone, representative or champion of this approach or strategy. In addition to both, defining and aligning, we also headed towards a refining stage, where we found that organizations move from, these general ideas about leading indicators into actually categorizing them and organizing them into something usable. So this is where we had companies begin turning broad concepts into more of a structured set of indicators that they could measure, test, and improve over time. And what we discovered is that leading indicators naturally fell into some easily identifiable patterns, and then refining them meant that understanding those categories and how each one functions in a safety system is an incredibly important and useful tool for folks to be able to make sense of both how the metric itself will impact their organization, but also in terms of the intention behind the metric itself. So taking into consideration all of those pieces that we just discussed, essentially. And then, uh, you know, so as we move into refine, I wanted to show that the work that we did across the last decade, pretty much dust decade, shows that once organizations define and align their indicators, we saw this opportunity to organize them into this clear structure. So we created this taxonomy of leading indicators where across the work that we did, we saw all of these patterns kind of fall under these three different categories of behavior-based, operation-based, and then systems-based leading indicators. And these categories appeared again and again because they help organizations understand what they are measuring and why. So behavior-based indicators here, they're capturing things, about actions and interactions, where operations-based indicators focus on work processes and equipment, and systems-based indicators reflect, the strength of the overall EHS management system. And this taxonomy became the foundation for what we created a leading indicator matrix, where companies or categories were expanded and then turned into into a practical tool that organizations can then use, choose, compare, and mature their indicators with. And that's really what you see here. Um, so this is a image of the leading indicator matrix. So you can see the split into operations, systems, and behavior-based indicators. The matrix was built, really through collaborative benchmarking across member organizations, where each category was broken down into second and third level indicators, and then paired with specific example metrics. So the goal here was not to prescribe a universal list, but really to give organizations a structured place to start, or like a menu of indicators that could be adapted and tested based on their maturity, risk profile, system needs, etc. And so these are essentially the bridge from high level taxonomy to a useful framework, and one that helps organizations choose indicators intentionally and understand how different types work together across the system. Now that we've seen, the full taxonomy of the full leading indicator matrix, we are the last phase of this research was really the design stage. And this is where organizations took those categories and metrics and began figuring out how to actually deploy and improve them. So across the Campbell Institute research, members consistently emphasize that designing a leading indicator program means creating the processes, roles, and expectations that make indicators actionable. So it's where organizations align their metrics with workflows, set clear expectations for each level of the organization, and then integrate leading indicators directly into the safety management system itself. And then the design phase also involved planning how indicators would be evaluated, refined, and then communicated over time, ensuring that they evolve as the organization learns. And so this is really essentially a pivot from moving from what the indicators are to how they will be put into practice. And across the Institute's projects, members submitted their leading indicators that they were actively tracking. Those indicators were then categorized and compared, creating a comprehensive list that showed how organizations put these metrics into practice. And from there, the work group or the member organizations ranked each indicator by organizational maturity and complexity, and really essentially to answer two questions. How ready does an organization need to be to use this indicator, and how much effort does it take to collect and analyze it? And so this is really, shifting from moving, from building the framework to understanding which indicators make sense based on different stages of maturity, and then how organizations can choose the right starting point based on where they are in that spectrum. And so after collecting and categorizing all these indicators, the members then went one step further and actually ranked each indicator by complexity. And that was really meaning, how much coordination and time and effort does it take to use it and track it effectively. And so the categories that you can see here, the low, medium, and high complexity, help give organizations an opportunity to understand what it realistically takes to implement a given indicator. In this sense, low complexity was that indicators were really relying on the data that many organizations already collect and require minimal coordination to use. Medium complexity was that indicators needed, more cross-team coordination and more structured tracking, but they were still generally manageable for most sites. And then high complexity was that indicators, really required deep coordination across functions, more sophisticated data systems, more mature processes. These tended to be used by organizations that were very far along in their safety journey. And so what this did was that it helped translate the matrix from a list of possibilities into more of a roadmap where we were able to show what indicators are realistic depending on your organization's readiness and resources. And so the next couple of slides I wanted to share are actual examples of how the Institute ranked leading indicators by organizational maturity and then complexity as well. These examples come directly from the benchmarking exercise. It can actually be found in our publication on leading indicators. And you can see here, just the variety of different events or different metrics that folks were actively tracking and then how they were ranked. So that second column there, you see the organizational maturity. That was based primarily on the DuPont-Bradley curve, which is that 5-point scale from reactive to interdependent. Indicators that required things like a strong culture and discipline and shared ownership fell, on the higher maturity levels than those that did not. And then there was, on that third column there, you can see complexity, which we just discussed, the time coordination and data systems that are required to consistently track the metric. And on this slide, you see just these examples. They're really here to illustrate, how basic entry-level indicators, like things like hazard reports and training completion and inspections, tend to sit, in the more reactive, low complexity quadrant because most organizations already collect that data with minimal effort. And then as you move, towards the more analytically intensive metrics, you're seeing more integration across functions. There's requirement of more mature systems to both implement, track, and interpret. And so you can see the full, like I said, you can see the full list of examples in our publications on our website, but just wanted to share a couple more here with you today. This set highlights, a set of leading indicators that fell within training and the competency family. So you can see at the table, those indicators ranged from basic measures of training activity to more advanced assessments of program performance. Most of the metrics are here were categorized as reactive or dependent maturity and then low to medium complexity. And that really reflected the nature of training data in itself. Basic compliance metrics like percent of trainings completed or percent of new hires that completed orientation tend to be reactive and more low complexity because the data is routine and more widely tracked. More advanced program indicators such as employees trained in Six Sigma or BBS or compliance versus program requirements fell more into the dependent and medium maturity or medium complexity range. Several indicators like the percent of compliance versus program requirements or the number of incidents with a root cause or lack of a root cause of lack of training are mark medium complexity as well because they require things like audits and investigations and more advanced evaluation of training effectiveness. So this slide really does show how, even within one indicator family, so to speak, maturity and complexity can vary greatly. And then simple, completion counts to metrics that require deeper review of competency and program performance can all exist within the same, again, family, if you will. The next set of examples really focused in on leading indicators related to corrective action, closure, and work order management. Compared to training metrics, these indicators generally require more coordination across systems and functions, which is, as you can see here, reflected in those higher complexity ratings. Here, nearly all the indicators were classified as medium complexity, with maturity levels ranging from reactive to dependent. Metrics like percent of corrective actions completed by a due date, average time to resolve work orders, and number of open corrective actions fell into that reactive category because they were widely tracked, but they still focus on basic activity counts and timeliness. Whereas indicators such as corrective actions prioritized by risks and effective corrective actions verified by managers appeared on that dependent range because they involved more evaluating quality, more prioritization, or effectiveness, not just completion. So these examples really show how organizations process or progress from tracking volume and timeliness to actually evaluating the quality and the impact of their corrective action process. And now that we've seen, all those examples of maturity and complexity rankings, this slide here really shows how all that work comes together. It's really through practice and a plan to check cycle. And this was the approach that the Institute's members found consistently useful and utilized to both implement and, refine and learn from leading indicators. So, and this isn't just the Campbell Institute. Across, institutional and academic research, high-performing organizations treat their leading indicators implementation as a continuous improvement loop instead of just a one-time project. It involves, planning. They inventory their existing metrics. They clarify their roles and build communication plans around why these leading indicators matter. In Do, they start small. They pilot a few key leading indicators, involve multiple functions, and then define expectations at each organizational level. Then we go into the check, where you're really able to compare leading and lagging data, run correlations, and evaluate whether the indicators are actually meaningful and actionable for your organization. And then in ACT, they're really refining here, adding new indicators, redesigning those that aren't predictive, pushing forward on that continuous learning mentality, and institutionalizing changes as the system matures. So this is really the roadmap. It shows that implementing leading indicators is iterative, it's evidence driven, and it's designed to evolve over time as organizations learn what truly drives risk reduction. And I think that over time piece is especially important because that is really something I think that every organization will encounter. You're going to have shifts and changes in roles and responsibilities, in organizational strategic decisions to allocation of resources. The likelihood that a leading indicator will provide the same level of utility over a long period of time is just not it's a tough to trust, considering all of those different factors. So that this ACT phase of just refining, and making sure to evaluate the effectiveness of these indicators, I think is incredibly important in this space. I wanted to share just a couple of case studies. We have several featured in our leading indicator series, but I just wanted to highlight a few. This first one here, it comes from Owens Corning, and they developed what they call their yellow flag system. And it's a system designed to detect early signals of serious injury potential. So Owens Corning began by noticing patterns, spikes in injuries that often followed things like leadership turnover, increased overtime, and or major rebuild projects. And these became their first yellow flags, organizational organizational conditions that consistently precede higher risk. From there, they analyzed the relationship between these yellow flags and their lagging outcomes, and they found very clear correlations between the two. That work really became the foundation for their corporate leading indicator strategy, where percent overtime, on-time preventative maintenance, unplanned maintenance, and other factors were classified by risk level and then tied to a required containment action. A key part of that model, and one that was highlighted across the Institute's research, was how important it was to engage in multiple departments and not just safety. HR, operations, and maintenance each controlled variables that influence risk. So involving them strengthened both the predictive accuracy and the culture around these indicators. So with this case study, we saw this full journey take place. It started with an observation. Then they took to validating their data. They built a structured, risk-based leading indicator system, and then implemented and refined it over time, which is exactly the progression that we see across these high reliability organizations. Another case study that I wanted to share here comes again from our research, this time from DSM-Firmenich, which provides really a great example about how organizations integrate leading indicators during major organizational changes. After their merger, DSM-Firmenich needed to unify two different safety cultures and systems. And to do that, they selected 3 global leading indicators that every site would track. These indicators were vetted and validated by the operations leadership team to ensure they were both meaningful and relevant across diverse organizations. And this really reflected the Institute's broader finding that leadership validation was essential when standardizing indicators across especially complex organizations. And then at the same time, sites were given individual flexibility to add additional metrics that were tailored to their unique risk profiles, which is an incredibly interesting concept. It's a practice that's really strongly supported in our research on leading indicators, which note that things like site level customization improve both ownership and relevance of the metrics themselves. And then finally, the rollout was phased. It started with building a legacy system and pilot sites or piloting on site. And this was incredibly helpful and important to their overall progress because they were able to start small, test the indicators, and then scale once the data and processes were stable. This wasn't something that they rolled out all at one time without testing, so they were able to anticipate all those different types of challenges and overcome them before actually trying to do the company-wide rollout. So this case study really showed how they combine things like standardization and validation and local flexibility and autonomy to build, a more unified and practical set of leading indicators after their merger. To wrap up this, wrap up all this work really, I wanted to just highlight some of the key themes that emerged, across all of the Campbell Institute's leading indicator research. So first, and I think incredibly important, leading indicators are an evolving concept. Across our papers, across our research, and across organizations and industries, folks consistently moved from activity-based measures toward more mature system-based indicators as their programs developed and their data capabilities improved. The second was that really implementation is iterative and integrated. The research shows that very few, I'll say, organizations get it right on the first try. Leading indicator programs are refined. They are designed to be refined and, really can be through that plan, do, check, act cycle where you're looking to adjust your metrics, you're looking to improve your data quality, and you're looking at integrating indicators into existing EHS systems over time. The third was that context is really important. Different indicators predict different kinds of events. So our work repeatedly notes that low severity incidents follow different pathways than things like serious incidents and fatality events. So leading indicators must reflect the organization's true risk profile. And then finally, this is a continuous journey. Every paper emphasized that leading indicators require ongoing evaluation, adaptation, and communication. Organizations that sustain improvement are the ones that continually analyze performance, share lessons learned, and mature their indicators as their systems evolve. And so to say here, just one thing to say about, really the big picture is that leading indicators are not static. They're not static metrics. They're part of a long-term process, learning process that both strengthens an organization's ability to prevent serious harm and provides new levels of information for folks to be able to interpret and apply based on the context of your organization's risk profile. So, you know, how can I use the research that the Campbell Institute has just talked to me about for an hour? Um, I just wanted to provide some examples here of some of the ways I think this work could be really, utilized across organizations. Um, First, we have the framework and taxonomy published and freely available to folks, and that's really a starting point for your conversations within your organizations. Looking at the three categories: behavior based, operations based, and system based, and giving people common language and to help them move the discussion beyond those activity counts and lagging metrics. Then his second is really drawing on those real world case studies from across the Institute's papers. I gave just a few examples, but there's so much to learn from what other organizations are doing, where they've been successful and where they've had challenges. It's one thing that Campbell Institute members are so passionate about is really making sure that that information is communicated out to the larger audience and for the opportunity to learn and improve in both the field and individually. And then finally, always feel free to explore the additional tools and resources in the Campbell library. We have that full leading indicator matrix, but also implementation guidance, benchmarking insights, and more. So these are, your resources to select your indicators, to build your programs, and really understand what leading organizations are measuring. I also wanted to just share, just some entry level metrics that for folks that might be just looking to get started on their leading indicator journey. Um, we identified these as the most accessible for organizations that are just beginning to build a leading indicator program, and they typically fall into the reactive maturity level and low complexity category. Um, and you can see here they include things like hazard reports, inspection counts, training completeness, data that most organizations are already collecting in some form. I think one thing that's really important to understand with interpreting, these metrics is that these are not prescriptive of the most ideal or predictive metrics. They're really a practical starting point for folks. You might even identify some activity based within this system or within this list. So it really should be emphasized that organizations should begin with metrics that are, easy to implement, things that can build early wins, things that can create consistency, not necessarily the most advanced or high value indicators right away. Starting simple helps organizations develop these types of habits where we're seeing improved data quality, where we're improving communication patterns. And those are types of components that are really required before moving on to those more mature and higher complexity indicators. So this table isn't showing which indicators you should aspire to long term. It's showing the indicators that help organizations take their first step and build that foundation that's needed for more meaningful metric implementation later. And here is some just the rest of the of the table that did not fail one slide. But you can see additional measurements here that still fall into typically that lower complexity and reactive maturity ranking. These indicators, are in addition to the others, they can be tracked almost immediately for some folks. We know that this data already exists, and the workload is minimal for folks to actually be able to get this, for themselves. Um, the implementation guide, I will say it identifies several basic hazard and observation-based indicators. Um, Things like number of observations per month, number of employees trained, and hazard identification, number of checklists completed, and more. And all of these really fall squarely into that easy to gather, easy to start category because they rely on that information that is already captured or is in their inspection or their BVS processes. You'll also see, simple training related indicators like percent of required trainings completed, number of safety talks held, and orientation completion rates for new hires. And these depend on basic LMS or HR data. They're not advanced analytics. But potentially really valuable and important for organizations just looking to get started on their journey. um, you know it's and I'll emphasize just once more, and I think the most important thing from these metrics is to understand that they're not chosen because they're the most predictive. They're chosen because they help organizations begin the process. They're here to, create habits. They're built to designed to normalize data collection and strengthen communication. They create a runway, so to speak, for organizations looking to move into higher maturity metrics, like things like risk scoring and correlation analysis and system level performance indicators and the likes. Um, and so as we look ahead, I think it's important to acknowledge that there's plenty more research to be done in this space. Um, you know, we have several listed here, but there's many more even beyond this. I just wanted to highlight a few that kind of emerged from our research and some areas that we're particularly interested in looking at in the near future. So first is statistical validation. And this came to be because across the studies, we saw repeated expression from organizations that they need to better understand which leading indicators actually predict outcomes. Many members have tried like correlation analysis and the likes, which compounds its indicators across different across incident rates, but there is a clear need for more rigorous and standardized testing across industries in this space. The second is longitudinal evaluation, and this is really because leading indicators evolve as organizations mature. We highlighted the importance of long-term tracking to understand, how indicators gain or lose predictive power over time. Some organizations, noted that indicators were useful early and then became, less informative later, which really reinforced to us the need for some multi-year analysis. And then the third here is looking at the relationship between technology and leading indicators. The papers point towards a growing role for advanced analytics, things like machine learning and automated data capturing. And we note that emerging interest in AI has been used to identify unsafe behaviors, analyze patterns, and observations and near misses, and even generate real-time leading indicator data through sensors and computer vision and tools like this. These tools will very likely reshape what leading indicator, both tracking, analytics, and reporting look like in the coming years. And because of that, it is a very high priority from the folks here at the Campbell Institute Research to maintain or to investigate and understand more that relationship and where we see success and where we see challenges in these emerging tools. I just wanted to give an opportunity here to take a step back and highlight a resource that I discussed throughout this presentation, which was the NSC SIF prevention model. This model represents, the next step in the evolution of safety metrics in some regards. It moves beyond counting injuries and recordables and focuses directly on serious injury and fatality exposure. The high energy hazards and system weaknesses that traditional metrics like TRI or don't capture are the main point of priority in the NSC SIF prevention model. And our research has shown repeatedly that SIF events follow different pathways than those low severity events, and that's why this strategy is really important and really needed or necessary. This model does provide organizations with, a structured way to identify, analyze, and respond to SIF potential events using the same principles that we covered today. Meaningful leading indicators, quality data, and a focus on systems and controls. And you'll notice here the model is live. It's available at nsc.org/SIF. It's designed to be used in real time with tools and guidance and resources that help organizations classify events, understand precursors, and take action before serious harm occurs. If you haven't had the opportunity to explore nsc.org/SIF, I highly recommend it. It could be a great opportunity no matter where you are in your leading indicator journey or in your metric journey to start prioritizing serious incidents and fatal events. And learn from, some of the most passionate folks in the industry, where we think the recommendations and guidance should head, and how to actually see this through in a structured and meaningful way, an intentional way. In addition to that, we are also taking part in this great and exciting opportunity where we're launching a national effort focused on reducing serious injuries and fatalities by actually testing the NSC SIF prevention model with organizations like yourself. This program is really designed for organizations that want to be early adopters of the proactive risk-based approaches that are embedded within the SIF prevention model. Participating means helping shape the tools, testing new strategies, and contributing to real-world data that strengthens the model for the entire field. I think, especially in regards to different type of industry and different size of organization, those complex organizational factors that are so important to understand to make tools like this more applicable to a larger audience. There's some traits listed here to determine if your organization is ready. We really emphasize folks to join if they have a strong commitment to learning, they have strong leadership engagement, they have a proactive mindset, and a willingness to pilot new approaches. So this is both, a call to action and an opportunity really to join a collective effort aimed at reducing some of the most serious and life-altering events in the workplace and to help define what effective SIF prevention looks like in the future. So if you are interested in getting involved, I just wanted to provide some steps to outline how you could get started. First, we have an informational packet that describes everything that you would need to know essentially to before participating in our model testing. It lays out the project scope, it sets expectations, and then gives a brief insight into what participation looks like, so you can decide whether or not this is a good fit for your organization. And then, confirm resource readiness, making sure that your internal team has the time and capacity and support needed to participate effectively. Gaining leadership support is incredibly important. As we've seen in the research today and throughout the different topics that we cover at the Campbell Institute, leadership commitment is one of the strongest predictors of success. So incredibly important to get that buy-in in this regard. And then finally, there is an intake form at the end of the informational packet that you can submit, through Qualtrics survey software that just asks a couple of brief questions about some organizational factors that we will take into consideration as we're onboarding folks into the study. And then finally, I put my email there down at the bottom, just in regard to, any questions related to model testing, but also any questions related to everything that we've discussed today. I'd be happy to discuss more with you on a one-on-one basis. So please feel free to reach out to me with any questions. And last, I just wanted to take a moment here to say thanks to my entire team. None of this work would be possible without all the folks on this list. They work tirelessly to support our research, to keep us on track and organized, and to make sure that, we're focused and prioritizing the most important and meaningful trends and topics. So just like a huge thank you to the Campbell Institute team here and to the members that participated in this research. You know, it's incredibly, I am incredibly appreciative of all that you've had to offer and share in this time. And it really has been an honor to get to walk through it with you all today. Um, so I know I have about 3 minutes left, Kinsey. I don't know if there were any questions that rolled into the chat. I don't have it open.
Yes, there is actually one question in the chat. Is there a general threshold to target on those leading indicator percentages for companies transitioning from lagging to leading?
It's a good question. We don't provide a general threshold, and I would be cautious of anyone that did, because there are so many compounding factors that organizations need to consider that go into something like a threshold. So my recommendation would be, more to look at piloting and see what those initial results look like and start to work and tailor within your own organization.
Thanks, Carolyn. I don't see any more questions in the chat, so I think we're probably good to wrap up.
All right. Well, thank you folks so much for sticking around today. I really appreciate it. I'm looking forward to any follow-up conversations with you all. And yeah, I don't think we have any other updates from our team. So take care. Until next time.